Good morning, one and all. I am Dr. Bhavya. Today I am here to present my topic on comparative analysis of dry eye questionnaire and ocular surface disease index in assessing dry eye symptoms. My financial disclosure in this paper was nil. To begin with, dry eye disease is a common multifactorial ocular surface disease with prevalence of 14.5%. In order to evaluate dry eye disease, a short questionnaire, which is a sensitive and a repetitive tool, is required for large epidemiological research studies and clinical research. The Ocular Surface Disease Index is a 12-item questionnaire that uses 3 subscales to assess the dry eye symptoms, mainly ocular symptoms, visual-related function, and environmental triggers. The dry eye questionnaire consists of 5 questions that assess the following: frequency of watery eye, discomfort and dryness, that is scaling from 0 to 4, late day discomfort and dryness, that is scaling from 0 to 5. Our aim is to evaluate the effectiveness of the Ocular Surface Disease Index and dry eye questionnaire 5 in non-clinical population. Objectives: to compare the DEQ5 and OSDI questionnaire in terms of their validity and reliability in assessing dry eye symptoms, to assess the sensitivity of DEQ5 in comparison to OSDI, and to assess the correlation between DEQ5 and OSDI. Ours is a cross-sectional study with 55 patients with study duration of 3 months, and convenient sampling technique was followed. Informed consent and institutional ethical clearance was taken. All individuals more than 18 years of age were included, and ocular inflammation or infection or any other previous ocular surgeries based on self-reported medical history were excluded from the study. These are the 2 validated questionnaires of dry eye symptoms were taken, that is OSDI and DQ5, and the data was calculated using these 2 questionnaires. The data was analyzed using Microsoft Excel. Descriptive statistics for continuous variables are represented as means and standard deviation along with a 95% confidence interval. The association between both the questionnaire was compared using Bland-Altman plot, and the Pearson correlation was done for continuous variables. Reliability was assessed using Cronbach's alpha, and sensitivity of both the questionnaire were assessed using receiver operative curve and area under curve. Our results: the age distribution of our sample lies with mean of 53 and standard deviation of 12, with 95% confidence interval of 50 to 57, with the male to female sex distribution of 1.2:1. OSD score has mean of 68 with a standard deviation 14, with the 64 to 72 of 95% confidence interval, and the DEQ5 score has a mean of 12 with a standard deviation of 2, with 95% confidence interval of 11.96 to 13.42. And the Pearson correlation, which revealed of the value of 0.6, shows a high correlation between the 2 questionnaires. This is a scatter plot representing the agreement between the OSDI and DQ5 questionnaire, with upper limit of agreement of 80 and lower limit of agreement of 12 with bias of 55. And the Cronbach's alpha of OSDI is 0.78, while that of the DEQ5 is 0.52, which shows that OSDI has good reliability when compared with DEQ5. And the receiver operative curve of OSDI has a cutoff score of 68 with sensitivity of 0.78 and area under curve of 0.9. The cutoff score is a point where there is a maximum sensitivity with the minimal false positive reads. And the ROC curve of DQ5 has cutoff score of 15 with sensitivity of 0.34 with area under curve of 0.7. Discussion: Samrat et al. Published a journal in Indian Journal of Ophthalmology concluded that patients with negative OSDI score should also be reassessed with DEQ5 to exclude symptom positivity. And Zerri et al. Published a journal in Transitional Vision Science and Technology concluded that modified Sheen questionnaire is rapid to administer and score compares well with the OSDI for test efficacy. And our study, which was done in Allu Sitaram Raju Institute of Medical Sciences, Andhra Pradesh, has limitations of that the patients of this study were sampled from small area with which might not reflect the whole population. The results may not affect the applicability of findings to the individuals from other races and ethnicity. The exclusion criteria is assessed by observation and self-reported history, which might not be the most accurate. Conclusion of our study: OSDI has good reliability and sensitivity in comparison with the DQ5 score in evaluating dry eye symptoms in dry eye settings. These are my references. Thank you.
Have you heard of Dew's classification of dry eye? Dew's, DEWS.
Dry eye workshop.
Classification, can you tell us? Level 1, level 2,
Yes,
level 3.
Level 1, we assure the patient that the symptoms are relieved but not the causative causative agent for the dry eye is not fully treated, and in level 1 we ask the patient to have compliance with the treatment and to be in low humid climate conditions, and we ask the patient to have lid hygiene in level 1. In level 2 we go with preservative free lubricants, any punctal plugs, and in level 3 we go for surgical procedures